Hi there, my name is Lexi Chavez, and I'm the Refugee Health Coordinator at Nationality Service Center. And today we'll be discussing how to support clients in navigating health insurance. So one strategy that we use at NSC is a health orientation for all new arrivals within a few weeks of their arrival date, and preferably before their first appointments. It's an early introduction to the concept of health insurance and the importance of having health insurance in the United States. A lot of clients arrive with some preconceived notions or exposure to the exorbitant prices of healthcare in the US. And so it works pretty well to address those concerns, especially if they're arriving with a history of some sort of medical condition, to let them know that they do have insurance. They'll start off with a temporary insurance that they will receive these cards in the mail. First, the access card, which they can use until their permanent insurance becomes effective. And we show them these visuals so they know what to look out for in the mail and they know to contact us once they receive them. Another thing that we emphasize is to ensure that their name is spelled correctly on the cards and that they have the correct date of birth. Some billing issues do come up later if the insurance cards don't match medical records or medical bills. So we want to avoid those. And clients are pretty responsive to this, and they know the importance of having these cards, making sure they're correct, and then taking them to all of their medical appointments. We also discuss some other health insurance options in case the client ends up not being eligible for Medicaid in the future. So we explain that right now they have an income-based insurance plan that's provided by the US government. They can continue to have that insurance if they're still eligible, but if they start to make too much, the other option is to receive insurance through their employer or to purchase it on their own through the penny marketplace. Obviously, at the time this health orientation is done, it's not very relevant, but clients know that if this issue does come up in the future, they can come back and they know that there are options that we can assist them with, and we can help connect them to other organizations that can help enroll them or screen them for other options as well. During this time, we also explain the benefits that clients have through their insurance. So we start to explain that insurance will pay for essential medications like insulin, blood pressure medicine, and that those are received from the doctor with a prescription. They just need to go to a pharmacy and pick those up. But that insurance doesn't always pay for medications that are readily available to purchase on your own without a doctor's note. So those over-the-counter medications like vitamins or acetaminophen, things like that. So we really start to introduce the idea of something being in network versus out of network as well, that we have to make sure that if they need an appointment, we're scheduling it with a provider that their insurance will pay for. And we also explain the services that are covered as a part of routine preventative care, which includes vision and dental. And we explained that there are a certain amount of vision appointments per year and a certain amount of glasses that insurance will pay for per year. And that for dental services, only routine services are covered. We go ahead and give them a heads up that for adults, more advanced procedures like root canals or extractions are a little more difficult to access, but that we have resources to assist. But just to let them know that there is that structure of what services they can and cannot receive. We also enroll our clients in their MCO. You can see here there's a map of the different districts in Pennsylvania, and you can see which plans are available in your area. In our area, Health Partners and Keystone First are the most commonly accepted insurances, so that's what we use. But these resources are available online on DHS sites, so you can see which plans are in your area. You probably already have an idea of which clinics or how many clinics are accepting certain plans, and would make it easier for your clients to access resources. On the DHS websites and on the enrollment services page specifically, there are also these comparison charts. So you can see and you can also show clients what is covered under their insurance and also discuss the idea of copays that sometimes at an appointment or for a medication, they might have a copay. So the amount that insurance is not going to pay for. So insurance will pay for everything but $1 per prescription, things like that. And you can access one of these for your region as well if these plans aren't available in your area. They are specific to the region. This is just what we use in Philadelphia. For MCO enrollment, the most convenient way to do this is to go to enrollnow.net and enroll your clients online. You can select their primary care provider and their MCO without the client present. But if this doesn't work or if you're unable to navigate this, you do have to call enrollment services with the client on the line in order to complete this enrollment. You would have to request an interpreter. We're not usually able to use our own interpreters, or if we speak the same language as the client, we're not able to interpret because the enrollment services staff needs to get that consent from the client and use their own interpreter. So it can be quite time consuming. Another thing to keep in mind is that you are ensuring timely enrollment. The deadline to enroll and choose your own plan in PCP is usually a couple weeks after the case has been approved and become active. If that deadline is not met, the clients are auto-enrolled in a plan and auto-assigned a provider, which can be quite tricky to correct and cause a delay in services. We've had issues where clients are auto-enrolled in a plan that fortunately none of the clinics that we partner with accept, and so there's a delay in getting them connected to care. To actually access the case, it's quite convenient. You can access it using the recipient ID number on the access card. But if clients haven't received that yet, which sometimes it does take a while and it can even be past that deadline to enroll, you can use the EBT card. So once you put in the primary on the case's EBT number, recipient ID, you can access all family members. So even if you actually have another case member, so if you have one child's access card and you put in their name, date of birth, and the number on the access card, you can enroll the parents and all other siblings, which is really helpful. And if nobody has received an access card, that recipient ID number is also located on the EBT card. You'll see there are 16 digits at the bottom of the EBT card. There's 10 digits that are spaced separately in the center. That's the access card ID as well that you can use here. And then once you have successfully enrolled the client, you see this confirmation page and the activation date of the MCO is provided. That's important to keep in mind and note because later on when there is a transition in their coverage, there can be billing issues. So if somebody hasn't received their health partners card yet and they're going to appointments and the clinic is still billing the access insurance, they'll start to receive bills for those later once the access declines to pay for those appointments. So it's nice to have this date where you know that any bills after that April 15th date will need to be updated with the health partners plan, not the access insurance. To change the PCP, you can't do this on Enroll Now. If somebody's just enrolled in a plan and you just want to change the PCP, you have to call the insurance company with the client. You should prepare the client for this call, specifically for the information they will need to provide. So the insurance company will need to call an interpreter. The interpreter will ask the client to verify their name and address, which we really need to practice with clients if they are new arrivals, they haven't memorized their address, or if there's that language barrier. We have to make sure that they can actually say their address in English. And then we can't use our own interpreters for these calls. We have to use the insurance companies. And then making sure beforehand that the PCP that you are selecting with the client is accepting that insurance and accepting new patients, because even though we pick a PCP, sometimes they don't have a new patient appointment available for 6 months. So checking in advance to make sure that that PCP selection will work. And then you'll also be asked for a provider's NPI number. So whatever doctor is practicing in the US has a unique ID number. You can find it with a quick Google search. Just put Dr. Greenberg NPI or something and it will pop up quickly. So medical bills are also tricky. You It often happens because of an error with that date of service, where maybe something was a couple days after the activation of the MCO, but bills were still being sent to the wrong insurance company. So we have to call and make sure you confirm that date of service. An issue that can also occur is if your client needs to go to the hospital or to a clinic before their CAO case is approved, before any of their benefits are active. But that can be corrected later because the insurance coverage will actually be backdated to before you receive their case approval. So you can tell your client that if they need to go to the hospital, to just request a bill to be sent to them. If their case has already been submitted or applied for, that's something you can deal with later. And again, just make sure you are ready to call with the client, request an interpreter, provide the correct insurance information. And then if there is no coverage or if you still aren't able to get rid of the bill, you can ask for charity care options. There's usually financial aid resources available through each hospital or medical system. And so those can require some paperwork to be filled out to provide like income, household size, and then to get a new bill with a lower price. You can also help a client get on a payment plan if they just communicate with whatever financial aid counselor what amount they're able to pay. The financial aid counselors are usually pretty flexible and can work with the clients. Some tools that we've used to promote independence. This is a welcome letter that we provide. So this is upon arrival during the 24-hour visit, the case manager will give this welcome letter with this information to all clients. It has the contact that they'll be working with for their first 6 months on our health team. We also fill out the nearest emergency room, both the name and address. And we have that 911 there, obviously, and this is translated into different languages so our clients can read it. We also provide the family doctor address and phone number so they start to familiarize themselves with what this primary care home is. And then in the health orientation, we also kind of go over what a primary care doctor is. This is the doctor that your child will see for vaccines, things like that. So they start to memorize the name of the clinic, their doctor, and all of that. We also go ahead and give them the dates and times of upcoming appointments, and that includes their initial blood work and the initial health screening. We go thoroughly through this and we explain what it is during the health orientation, but it's nice to give clients that structure and that schedule so they know what's going on within 1 month of arrival. And they know why they're getting this blood work and why they're having this thorough appointment. We also give them a list of documents and items they need to bring to their first appointment, the insurance cards, either the temporary one or the permanent one, whichever they've received in the mail. Also their IOM bag, we ask them to bring any overseas records, things like that. And providing these visuals for clients really helps, especially if they're pre-literate or if one household member is pre-literate. It's good for them to have this visual guide and still be able to understand what this document is asking of them. And we also ask them to bring any medications so that they can review that with their provider. And then we also emphasize to everybody that it's important to take their ID card and insurance card to every medical appointment. They always have to have something with their name, their date of birth, and a photo. Another resource that we've provided is this PCP card. So somebody, if they're enrolling their child in school or if they're at their employer's office and they need to call their PCP, they're able to communicate who that doctor is, or they can use this card to call their clinic on their own to maybe request a sick visit. And one thing that you'll see that's included at the bottom is those 2 1s. Those are actually the prompts that our clients, or the numbers our clients need to press, because when you call, it's an automated prompt. It's not, you're not talking to a real person. But we include that because those are the numbers that we know they need to press to actually get in touch with somebody at the front desk or a real person that they can ask for an interpreter. So just that little tip. Another thing on the back of that is this tool that people can use at a pharmacy. So if they are having trouble verbalizing what they need at the pharmacy, they can just point to this and it'll communicate to the pharmacist what they're there to do. And then again, at this point, they usually always have their insurance and ID card as well. So the pharmacist can use that. And then if we're ever sending somebody to an appointment and we're unable to accompany them, or if they're having to go to the hospital and we're not able to go to help register them or anything like that, I can send this text message to my clients and just tell them to show it to somebody at the hospital. Or even if they have an appointment at a big campus and I know that their appointment is going to be in one specific suite on like the sixth floor, I'll tell them to like find a security guard and show them this message to say where you need to go. And this is really helpful because then I can also provide my information. Like if there is an issue, please call my caseworker and put my number. Another thing that we really emphasize for our health team members is explaining everything that we're doing to the client without jargon. So we avoid using terms like PCP and really say family doctor and always explain like this is the family doctor that you see with your children. This is the family doctor you saw about that issue or things like that. And then really complicated verbiage like prior authorization, even though clients aren't able to sometimes handle this completely independently to start. We explain what the process is. So we'll explain, okay, like we can help you schedule this appointment, but we can't do that until we receive something called a prior authorization. It just means that the insurance company is going to have to give approval and your doctor's going to request that from them. So explaining the process and making sure that they're still informed and they feel like they are actively involved in their medical management and not just completely dependent on us for that. We also teach self-advocacy. So making sure that the clients know going into the appointment, if you have these concerns that you've expressed to me, that's something that you really need to discuss with your doctor. If you need to tell them that you need to speak to them further, you need to schedule a follow-up, that's something you should be comfortable doing. We also create step-by-step guides, like the teleprompts that you saw on the PCP card, but we'll also create a list of specialists that somebody sees, or maybe we have a list of the family doctor, the pediatrician, and the dentist, and we'll include the prompts like that and include visuals so that if there are any pre-literate clients, they see the tooth and they know that's the dentist and they know that's the address. And then really encouraging clients to engage their family members in US ties to support them is helpful. The US ties are really instrumental in helping our clients with transportation navigation, and they're with the clients all the time. So it's really helpful to communicate with them if needed, making sure that they're able to help us teach the client how to get to their PCP, know when to go to the PCP instead of having the client come to us if somebody is sick, knowing where to access care and when it's appropriate.